Center Maine is partnering with the Maine-Monitor to bring you some of the reporting being done by journalists at the nonprofit independent publication. We'll be featuring one of their stories each Monday. Today, we are talking about a topic that hits close to home for many people around the state: maternity care. So you may remember a couple of weeks ago, we told you about the first in a three-part series from the Maine-Monitor on maternity care in Maine. The second and third stories in the series are now available, including an in-depth look at a growing trend of home births and solutions to Maine's maternal care challenges. So Emily Hedegaard is a reporting fellow at the Maine-Monitor. Thank you for being with us.
Thank you for having me.
Put a lot of work into this subject. This is the second story in this series. It focuses on midwives in Maine and how there's been sort of a rise in births outside of hospitals. So I want to start with this. Where do midwives fit into the picture here, and what is behind this 41% increase?
Yeah, so I just want to start by providing a little bit of additional context. So in Maine, there's sort of this alphabet soup of different certifications and licensing, and it varies state by state, but basically in Maine we have nurses who are midwives, and we call them nurse midwives, and then we have midwives who aren't nurses, and they're sometimes called independent midwives. And independent midwives will typically be practicing at a freestanding birth center or attending home births. So our research found that there has been a rise in use of both types of midwives statewide and nationally. Looking specifically at Maine, we've increased the way that we use nurse midwives within our hospitals, and there have been more out-of-hospital births that were attended by independent midwives. Now, that being said, it's still a very small number. Only about 3% of births in the state are happening out of hospital. But overall, our reporting found that many countries rely really heavily on midwives for obstetric care, and the midwives we spoke with in Maine really advocated for that. But there are big barriers to it here, and the infrastructure isn't really in place at this point in time.
We talk about the infrastructure, and especially we see some of these closures in hospitals throughout rural parts of Maine. Last time we talked a little bit about potential solutions, but what are you hearing from experts about solving the maternity care problems that Maine is facing?
Yeah, so experts that we spoke with said that we need to make it easier for doctors to train and practice in rural areas. And that's because research has shown that physicians in training will most likely practice within 100 miles of wherever it was that they did their training. Another suggestion that we've gotten from hospital administrators is that we need to make better use of the staff that we already have within our communities and within our hospitals. So that could mean a couple of different things. That could mean cross-training them in obstetric care. It could also mean sharing staff between hospitals that are within the same system. Additionally, it could mean that having staff that aren't doctors but are highly trained come in as first call, and then only bringing in physicians for more complicated cases or C-sections. Another solution that we heard was increasing access to providers that are typically out of hospital, like doulas and independent midwives.
I want to talk about this. Down East Community Hospital in Machias was worried several years ago that it might have to close its birthing unit, the only one left in Washington County. So tell us a bit about how they were actually able to keep that unit open.
It's a great question. And just to set the scene, like you said, this is the only hospital that has a remaining birthing unit in all of Washington County. And hospital administrators were afraid that they were going to have to shut it down because of declining birth rates in the county and because the unit was difficult and expensive to staff. So to answer your question, they did something really creative. They trained nurses outside of the obstetric unit in obstetrics, and that then allowed those nurses to flex between departments, and it significantly helped with their staffing shortages. Now, that arrangement has been in place for a couple of years now, since 2023, and although the transition wasn't seamless, when we reached out to the hospital in late February, they said that they were confident in the arrangement and that it's allowed them to keep their birthing unit open.
Emily Hedegaard, I know you have done a lot of research for this three-part series. Thank you for joining us and talking about it.
Yes, thank you so much.
And you can read so much more at the-maine-monitor.org.